We're going to talk pain now. Yeah, it is absolutely wretched living with pain, or even, let's face it, experiencing it momentarily. But we're going to drill down into some new research which has been published in the journal Nature Communications. And it's a kind of collaboration between the University of Vienna and researchers from the University of Exeter, the Penryn campus at Tremont. And apparently it's seen as quite a promising bit of research which could possibly lead to new types of pain treatments that don't involve drugs. I've been talking to one of those involved in it, Dr. Alex Smalley. This is really exciting stuff, this research. But could you just sort of describe in a potted version what the researchers have done and the conclusions they've come to?
Sure. So we put 49 people in an fMRI scanner. That's one of those big white tubes that you'll see that people go in, and it makes a loud sort of tapping noise. And what it's doing is it's imaging the people's brains by detecting changes in blood flow. Now, what we asked these 49 people to do when they were in this scanner was to watch scenes of either these nice immersive scenes of either a natural space, a woodland with a lake and birdsong, or an urban environment, a city, or an indoor environment. And while they were doing that, we gave them a series of small electric shocks to the back of their hand. And we asked them to rate how painful they found the shocks, but also we were watching what was going on in their brain with the scanner as they experienced those shocks.
Okay, so this couldn't just be subjective of I feel happier so I don't feel the pain as much. You could actually see the response inside their brain.
That's exactly right. And that was one of the big reasons we wanted to run this study, because we wanted to understand if the kind of effects that we've seen on pain in the past were simply that, whether they were just distraction or whether there was something more fundamental going on there. And what we found was that people did experience less pain when they were watching this beautiful natural scene compared to the other two, to the urban and the indoor. They found the electric shocks less intense and less unpleasant. But when we then looked at the brain scans, we found exactly the same pattern too. So you're right, that what that did was allow us to confirm this wasn't just distraction, it wasn't just placebo, there was something deeper going on there.
Were you able to quantify the difference between somebody looking at, a car park, I don't know what the image was, and somebody looking at a woodland or a lake or the sea?
Well, what was most interesting for us with these effects was that actually they were quite similar to the type of pain relieving effects we see when we ask people to listen to music they enjoy or when people undertake mindfulness activities.
What practical applications do you see for this, maybe in clinical environments or in places, hospital wards or hospices?
Yeah, I mean, that's really where we'd like to work towards, to understand how this kind of treatment could offer an alternative to typical treatments that tend to use drugs, these sort of pharmacological interventions. And you're right, like the obvious ones would be people who can't otherwise get outside. Our focus was very much on this virtual experience of nature. And you can imagine people who might be in care homes, in hospital settings, recovering from surgery. But I think also all of us experience these times in our lives where we're stuck indoors. And it doesn't have to necessarily be as serious as being in a care setting. For example, I work from home or in the office. I spend an awful lot of time indoors in front of my computer, and I can't get outside to experience nature. So if we can bring any of those, the cues and clues, the sights and sounds of nature, whether it's views of a lake or the sound of birdsong to people, to unlock some of these benefits, I think that can only be a good thing.
Where does the research go now?
Well, that's a really good question, and we want to do more work in this area. And the study that we've just run with University of Vienna had very much looked at what we call acute pain, these sort of immediate and sudden experiences of pain. But what we'd like to understand a lot more about is the idea of chronic pain and how experiencing nature might be able to alleviate long-term feelings, often slightly lower level, but long-term feelings of pain, which can be really debilitating for people, particularly thinking about examples like long-term back pain. And we've got a research group at Exeter, which is hopefully going to be looking at that in the near future.
It's interesting to me whether if you were permanently in a beautiful natural surrounding, would the effect of that continue, or is it the change from inside of a scanner, which is a scary and not very pleasant place to be, to be taken into the natural world? Is it the sort of shock value of, oh, I'm somewhere different? Or do you think, I mean, I just wonder about that. What do you reckon?
Yeah, it's another really good point. It's something we talked about within the team, that when people are in the scanner, there's two things going on there. One, it's a pretty difficult and offensive space to be in. It's very confined. You can't move. The scanner's very loud. So you're almost experiencing nature at its worst with all of those other things going on. But at the same time, as you say, there's not much else to look at when you're in the scanner. And so any distraction could be a good thing. But of course, we were able to compare our findings with both an urban environment and an indoor environment, which didn't offer the same effects. But that change in nature and how we reflect what makes an experience with the natural world really exciting is something that we started to look at. We spent some time looking at how changes that might be related to, say, sunrise or sunset or a sudden rainbow or storm can impact people's experiences. And we're finding they're able to unlock these incredible feelings like awe and wonder. And that's something that we're definitely going to be looking more at in the future too.
Who knows, in future we could be prescribed 2 whales and a sunrise, couldn't we?
I'd take that pill, yeah.
What do you
Brilliant,
reckon?
Alex. Thank you so much for your time.
What do you reckon? Dr. Alex Smalley there talking to me on BBC Radio Cornwall, recorded that yesterday afternoon, the idea that watching nature, red in tooth and claw, maybe it depends what you watch as well. Would it need to be a sort of tranquil lake rather than a lion bringing down a gazelle or something? Would that just make it worse?
It could be the 70s.